class we have discussed about the gross structure of the face. Okay, I have given the introduction, then orientation of the muscles, how they are oriented, what are the groups of muscle, where they are placed. Okay, along with that, we have seen about the skin, superficial fascia, and as I said, deep fascia is not there in the face, the facial region. Okay, next. If you remember, I have written some points. Okay, that day I wrote some points in the whiteboard. Okay, so according to that we are proceeding in the face. So in the face, when I have explained you about the skin, at that time I have shown you that face is having a rich blood supply. Okay, the blood vessels which are supplying the face, that we have discussed. Now in the blood supply of the face, two things are there. That is arterial supply and venous drainage. Okay, arterial supply already we have discussed. Okay, we have discussed about the facial artery, transverse facial artery, and other small branches which are supplying the face. Okay, next is the venous drainage. Okay, that day I think I have started with the venous drainage, so today I will continue with the venous drainage of the face. Now in venous drainage of the face, mainly there are two veins which are draining the most of the face. Okay, that is the facial vein and retromandibular vein. The way we have discussed the arterial supply, in the similar way we have to know about the veins. First of all, what is the landmark of the formation? Okay, if a facial vein is there, where it is formed, and after formation what is the course? Okay, and ultimately where it is terminating, that will be the facial vein. Same about the retromandibular vein also. Okay, so the facial vein is the largest vein of the face. Now how it is formed and where it is formed? As you can see, the facial vein, it is formed at the medial angle of the eye. Okay, so which is the medial angle? This is the medial angle of the eye. I hope you have seen the skull. Okay, so in the landmarks, cutaneous landmarks of the skull of the face, in the previous class I have shown you. Okay, so this is the medial angle of the eye. Two angles are there. This is the medial angle, this is the lateral angle, also called as medial canthus and lateral canthus. There are some important structures, we will discuss about that too. Okay, so where is the formation of the facial vein? So it is formed at the medial angle of the eye. Now how it is forming? It is formed by joining two important veins, that is supratrochlear vein and supraorbital veins. So these two veins will join together at the medial angle of the eye to form the facial vein. After formation, it will follow the course of the facial artery, but it will remain behind the facial artery. Okay, so as you can see, after formation it runs straight downwards and backwards behind the facial artery. Okay, and ultimately it will reach the anterior inferior angle of the masseter. Next, what will happen? It will pierce the deep fascia in that particular area. Okay, then it will cross the superficial to submandibular gland, and then it will join with the anterior division of the retromandibular vein. Okay, so retromandibular vein at the terminal part, it is having two division, anterior and posterior division. Now once it is joined by the anterior division of the retromandibular vein, then the common facial vein is formed. Okay, and this particular common facial vein, no, not allowed. This common facial vein will be draining into the internal jugular vein. Okay, now you know that internal jugular vein will join the subclavian vein to form the brachiocephalic vein, and ultimately two brachiocephalic vein, not allowed. Two brachiocephalic vein will join together. Two brachiocephalic vein will join together to form the which vein? As we see, superior vena cava, and that ultimately drains into the right atrium. This is the venous drainage. Now let me show you the diagram first. Okay, now here you can see the diagram. Now in this diagram you can see the formation of the facial vein. Okay, this angular vein is also termed as the facial vein only because it is forming at the medial angle of the eye. Okay, and after that you can see how it is descending. When it is descending, it is following the course of the facial artery, and it is situated behind the facial artery. Okay, now after that at the termination, as you can see, it is joined by the anterior division of the retromandibular vein. Okay, and then it will drain into the internal jugular vein. See this one. Okay, now this internal jugular vein will join by the subclavian vein of its side to form the brachiocephalic vein, and two brachiocephalic vein ultimately will form the SBC. So this is how the blood is drained. So this is one portion. Okay, as I said, two parts are there, two important veins are there. First, I have shown you the, which vein is this? This is the facial vein, the formation of the facial vein, and along with that you can see the tributaries of the facial vein also. Okay, see the external nasal vein, superior labial vein, deep facial vein, inferior labial vein, submental vein. So these are the tributaries of the facial vein. Okay, now another vein is there, that is the retromandibular vein. Okay, so the retromandibular vein which is there, how it is forming, where it is forming, that also you have to know. Okay, now if you see the retromandibular vein, how it is forming, it is formed by the union of the superficial temporal vein and the maxillary vein. Okay, superficial temporal vein and the maxillary vein will join together, and the formation is taking place within the parotid gland. Okay, so that day also I told you parotid gland is a very important structure. Once you dissect the parotid gland, you can see the branches. Deep to that you can see the branches of the facial nerve, and you can see important blood vessels like the formation of retromandibular vein. Now the formation of retromandibular vein is taking place within the gland. Okay, after that what will happen? It will descend. Once it is descending, okay, it will leave the gland. When it leaves the gland, it divides into two tributaries. What are these? Or you can say two division, anterior division and the posterior division. So after leaving the parotid gland, it divides into two division, anterior and posterior division. Now this anterior division, just now I have shown you, it will join with the facial vein to form the common facial vein. Okay, whereas the posterior one, okay, the posterior one will pierce the investing layer of deep cervical fascia, okay, and it will join with the posterior auricular vein. Now this posterior auricular vein is situated just below the apex of the parotid gland. Okay, so parotid gland का जो apex होता है, just below the apex of the parotid gland, these two veins will join, this posterior auricular vein and posterior division of the retromandibular vein. Okay, after that they will form the external jugular vein, and this external jugular vein ultimately where it will drain into the subclavian vein. Okay, so this vein will descend across the neck about the sternocleidomastoid muscle and will drain into the subclavian vein. Now here you can see the diagram. Okay, so see, this is the formation. This is the formation of retromandibular vein. Okay, so you can see this is the maxillary vein and superficial temporal vein. They will join together to form the retromandibular vein. Now this retromandibular vein is where it is forming. It is forming in the parotid gland. Okay, after that it will descend down. It will descend. Once it is descending, then it will leave the gland. Once it is leaving the gland, it will divide into two divisions, as you can see, anterior division and posterior division. The anterior division joins the facial vein to form the common facial vein, and ultimately it will drain into the internal jugular vein. Okay, and here the posterior division will join with the posterior auricular vein, as you can see in the diagram. This is the posterior auricular vein to form the external jugular vein, and this external jugular vein will ultimately drain into the subclavian vein. Okay, so in the venous drainage of the face, please note that you have to mention about the facial vein, and along with that you have to mention about the retromandibular vein also. Okay, now if you see the retromandibular vein, which are the areas? Now majority of the face, as I said, it is drained by the facial vein, but there are some areas which are drained by retromandibular vein also. Now what are those areas? As you can see, both the jaw, lateral part of the skull, parotid gland, and part of the masseter muscle. These are the areas which are drained by the retromandibular vein. Okay, so every time whenever you are writing about the venous drainage, please keep that in mind. You have to mention where the origin, or at which point the origin of the vein is taking place. Okay, and mostly the larger veins, 2 or 3 veins will join together to form a large vein, which I have shown you over here. Okay, then what is the course, and then where it is terminating. In between them, what are the tributaries, and then area of drainage, which particular area, which particular part is drained by this particular vein. Okay, these are the points should be there when we were writing about any venous drainage. Now, last class, I hope you remember, I have explained you about the dangerous area of the face. Do you remember? Can you tell me which is the dangerous area of the face? Yes. Okay. So why this is called as dangerous area of the face? Because of the deep connection of facial vein. So facial vein is connected to cavernous sinus. Cavernous sinus is a dural venous sinus which is situated intracranially inside the cranium. Okay, and that dural venous sinus is having connection with the facial vein. Okay. Now I hope you can see the diagram. Now see, this is the cavernous sinus. Okay, see, this is the cavernous sinus. So cavernous sinus, as I said, is a dural venous sinus. When you will study the blood supply of the brain, especially the venous drainage, at that time things will get clear. What are those dural venous sinuses? So many dural venous sinuses are there. Some are paired, some are unpaired. Okay, so among them, one important dural venous sinus is the cavernous sinus. Now you can see the cavernous sinus is having connection with the pterygoid venous plexus, and this pterygoid venous plexus is having connection to the facial vein with the help of deep facial vein. Okay. So, and another important point is the emissary veins which are there, they don't have any valves. Okay. So what will happen? There may be retrograde flow of the infection, okay, from the face. So if there is any pustule, pimple, or suppose any other problem, okay, and if the infection is going through the blood, so it can spread directly, and as a result thrombosis can form in the cavernous sinus. That's why this area is called as dangerous area of the face. Okay, this particular area is called as the dangerous area of the face. So this is a important applied part of the face. Okay, so dangerous area is because of the communication. So you can see the facial vein communicates with the cavernous sinus through emissary veins. Okay, so infection from the face can spread in retrograde direction. Retrograde direction means in opposite direction. Okay, and cause thrombosis of the cavernous sinus. Now this is especially likely to occur in the presence of infection in the upper lip and the lower part of the nose. Okay, upper lip and the lower part of the nose. That's why this particular area is called as dangerous area of the face. Okay. So that is all about the venous drainage. Next is the lymphatic drainage of the face. Okay. Now lymphatic drainage of the face is divided into three territories: upper territory, middle territory, and lower territory. Okay. And for each and every territory, the lymph nodes are different. So you have to know upper territory is covering which particular area, lower territory is, middle one is covering which area, and lower one is covering which particular area. Okay. So upper territory is consisting of forehead, latter halves of the eyelids, conjunctiva, parotid area, and adjoining part of the cheeks. So these are the area which falls under upper territory. For upper territory, particular lymph nodes are there. That is the pre-auricular lymph nodes, also called as superficial parotid lymph nodes, because they are situated in the parotid region. Okay. Next, middle territory. Okay, middle territory is consisting of central part of the forehead. Okay, middle half of the eyelid, external nose, upper lip, lateral part of the lower lip, and medial part of the cheek. Okay, and greater part of the both the jaw. So this is the middle territory. Now middle territory is drained by submandibular lymph nodes. Okay. Next is the lower territory. So lower territory, you can see lower lip and chin. Okay. Now this is drained by the submental lymph nodes. So these are the three group of lymph nodes draining the three territories of the face. Okay. Now the question is, once they are draining the lymph from the three territories of the face, after that where it will go? Once it is draining, it has to go somewhere. Lymph node will drain the lymph. After that, lymphatic vessels will be there. Okay, we have discussed about the lymphatic system. I have explained how the lymph is flowing in our body. Okay, from where it is forming and where it is going, and in between that what are present. All those things were discussed in the class. Okay, I will request everyone to study that, or else every time you will get confused. I know most of the student, you are having difficulty to understand this particular point. Lymph nodes are there, it is draining. After that what happens? Lymph nodes are there in the particular area. Okay, it is draining the lymph. After that क्या होता है? What happens? For that you have to know the direction of the flow of lymph. After that you have to know the structure of the lymph node, which you have not studied. Okay, you have to know about the structure of the lymph node and the function of the lymph node. Okay, structure means both microscopic as well as macroscopic structure of the lymph node. Okay, then only you will understand this lymphatic drainage. Because most of the time I have seen when I am discussing about lymph node, faces are empty. Okay, so and this particular lymphatic system already I have shared. It is there in the group. Okay, so please give some time and study that lymphatic system chapter. Okay, everything is given point wise, you will understand. Okay, after that if there is any difficulty, please come and ask. This part is also important. Okay, now the question is, this particular group of lymph nodes, when they are draining the face, after that where the lymph is going, that you have to know, because ultimately it has to reach the venous system, or it has to reach the venous supply. Okay. So there is no lymph nodes present in the scalp, okay, except the parotid and the buccal region, and there are no lymph nodes directly in the face also. So the lymphatic vessels which are present, that means just now I mentioned in 3 territories, 3 different lymph nodes are there. Okay, so from there the lymphatic vessels which will be present, superficial as well as deep, they will follow the blood supply. That means superficial will follow the vein and deep one will follow the arteries. Okay, that means they will accompanied by the facial vessels. Now superficial lymphatic vessels accompany the, as you can see, superficial vessel accompany the veins and deep lymphatics will accompany the arteries. Okay. Next, all the vessels of the head and neck directly or indirectly will drain into the deep cervical lymph nodes. Okay. So the lymphatics of the head and neck, directly or indirectly, they will drain into the deep cervical lymph nodes. Okay. Now this deep cervical lymph nodes, these are the chain of nodes located along with the internal jugular vein. Okay, in the neck, on both the side. Next, what will happen? Lymph from these deep nodes, okay, passes the jugular lymphatic trunk, which will join the thoracic duct. Okay, and on the left side. And on the right side, where they will go? They will go to the internal jugular vein or the brachiocephalic vein on the right side. So this is the termination. So 3 territories are there. From those territories, 3 different group of lymph nodes are there. From that particular part, the draining is taking place. After that, ultimately they will reach, where they will reach? Deep cervical lymph nodes. Deep cervical lymph nodes are the group of lymph nodes which are present along with the internal jugular vein, which is situated in the neck on both the side. Okay. From there, the drainage of right side and left side is different. In case of left side, it will go to the thoracic duct. I hope you have studied about thoracic duct, which is the largest lymphatic vessel of our body. Okay. So left side का जो है, that will go to the thoracic duct, and on the right side, where it will go, internal jugular vein or the brachiocephalic vein. Okay, this is how the lymphatic drainage of the face is taking place. Now here is the diagram. Okay, in this diagram you can see the territories. Okay, 3 different territories, and for that you can see preauricular lymph nodes, submandibular and submental lymph node. Okay, so from these lymph nodes, what will happen? The lymphatic vessels which are present, those lymphatic vessels will carry the lymph and ultimately they will reach the deep cervical lymph nodes, which will present in the neck along with the internal jugular vein. Okay. From there, left side it will go to the thoracic duct, right side it will go to the internal jugular vein or the brachiocephalic vein. This is the direction of the flow of lymph in case of head and neck region. Okay. Okay, so that is all about the gross structure of the face. Okay, so if you remember the points which I have mentioned that day, I don't know whether you have noted down those points or not. Mostly people don't used to write. Okay, simply sitting and relaxing under AC. Okay, and I have seen when a teacher is teaching something, writing important points, it's your duty to note down those points. Okay, it's okay, no problem. So the points which I have mentioned that day in the whiteboard, according to that I have completed up to the gross structure. Now the last portion which is remaining, that is the applied importance of the face. Okay, now the applied importance of the face, there are various points which we will discuss now. Okay, so I will start with the Bell's palsy. Anyone, have you heard about this Bell's palsy? Yes. Palsy का meaning क्या है? What is the meaning of palsy? Not directly paralysis. It is temporary, not permanent. Palsy का meaning होता है weakness or temporary weakness or paralysis, okay, of the muscles. And why it is called as Bell's palsy? Yes. Christopher Bell, famous Scottish neurologist, okay, discovered this particular phenomena in late 19th century. That's why it is called as Bell's palsy. Okay. Now, what exactly happens in the Bell's palsy? And there is a new term which I will be introducing today. Okay, what is that? That is the lower motor neuron lesion and upper motor neuron lesion. Anyone, have you heard about it? In physiology, have you studied about that? Nervous system, have you studied in physiology? No. Okay. So this concept is also important, you have to understand, because the lesions which are taking place in upper motor and in lower motor, the consequences are different. Okay. So I have divided the Bell's palsy into two parts. If the injury or if the lesion is in lower motor, then what will happen? If it is taking part in the upper motor neuron, then what will happen? Okay. So I have divided into two parts. So first we'll see what exactly happens in case of Bell's palsy, and then we'll discuss about the upper motor and lower motor neuron lesion. So in case of lower motor neuron type paralysis, okay, what will be there? There will be the paralysis of the facial muscles. Why facial muscles are paralyzed? Because there may be compression of the facial nerve in the facial canal near the stylomastoid foramen. Okay. Now the exact etiology or the exact cause is unknown, but it may be due to viral infection. In most of the case, due to viral infection, this particular Bell's palsy occurs. Okay. तो Bell's palsy में exactly क्या होता है? जो facial nerve होता है in the stylomastoid canal, it get compressed. Now why it get compressed, exact reason is unknown till now, but in most of the cases viral infection is there. Okay. Now once it get compressed, then what will happen? The facial muscles will get paralyzed. Okay. Now I hope you have noted that facial muscles are present in both the side, right side also, left side also. Okay. So suppose the nerve is damaged or nerve is compressed in one side, okay, then you will not see the paralysis of the muscles of both the side. On that side only the paralysis can be seen. Okay. So first of all, there will be facial asymmetry. Okay. Now what is the meaning of this facial asymmetry? The affected side is drawn to the healthy side. Okay. So suppose this particular side is affected, this side is not affected, then what will happen? The affected side, okay, so affected side will be drawn towards the healthy side because of the unopposed action of the muscles of the normal side. That is the facial asymmetry. Next will be loss of the wrinkles on the forehead. Okay, so the wrinkles which appears on the forehead, those wrinkles will disappear. Why? Because there will be the paralysis of the occipitofrontalis muscle, mainly the frontalis part. Okay. Next, there will be widening of the palpebral fissure. Anyone, do you know what is this palpebral fissure? Anyone, do you know what is this palpebral fissure? See, when your eyes are open, the upper eyelid and lower eyelid, in between them, the space which is there, that is called the palpebral fissure. Okay? Have you understood what is palpebral fissure? जो अपर आईलिड है, लोअर आईलिड है, दोनों के बीच में जो स्पेस होता है, that is the palpebral fissure. Okay? So here what will happen during the Bell's palsy, lower motor neuron lesion, there will be widening of the palpebral fissure. Okay? And there will be inability to close the eye on the affected side. Why? Because there will be paralysis of the orbicularis oculi muscle. And this orbicularis oculi muscle helps in closing of the eyeball. Okay? Next, there will be tears flow down from the eye, also called as epiphora, due to the paralysis of the lower part of the orbicularis oculi muscle. So, tears will flow down because there is the paralysis of the lower part of the orbicularis oculi muscle. Okay. Next, other features are also there. So, the other sagging of the angle of the mouth. Okay, sagging of the angle of the mouth towards the affected side. Why? Because inability of the angle of the mouth to move upwards and laterally during laughing because of the paralysis of the zygomaticus major muscle. Okay, so when you laugh, which muscle is helping? Zygomaticus major. Okay. Next, loss of nasolabial furrow or nasolabial fold. Do you know which one is the nasolabial fold? This one. Okay, this is the nasolabial fold or nasolabial furrow. So this particular fold will be disappear in the affected side. Okay, why? Because of the paralysis of the important muscle, that is levator levi superioris elacuvi nasi. That is the name of the muscle. Okay, due to the paralysis of levator levi superioris elacuvi nasi, this muscle get paralyzed. That's why there will be loss of the nasolabial fold. Okay. Next, accumulation of the food inside the vestibule of the mouth due to the paralysis of the buccinator muscle. Okay. Next, dribbling of the saliva from the angle of the mouth because of the paralysis of orbicularis oris. Okay. Next, there will be loss of resistance. Okay, when one presses the cheek with inflated. So, if you inflate the cheek and if you press, okay, so there will be leakage of the air will come out. Why? Because of the paralysis of the buccinator muscle. So these are some important features which can be noticed when a person is suffering from Bell's palsy. Okay, this is the diagram for Bell's palsy. So as you can see, the loss of the wrinkles of the forehead. So see this particular part. So this is the affected side. Okay. Now here you can see face is pulled to the healthy side, first feature. In the next feature you can see the loss of the wrinkles on the forehead. On the affected side, the wrinkles which are present on the forehead, that will be disappear. Why? Because there is paralysis of which muscle? Frontalis muscle, occipital frontalis part. Okay? Next you can see inability to close the eye because of the paralysis of the orbicularis oculi muscle. So you have to know that this particular phenomena is taking place because of which muscle. Next, what will happen? You can see overflow of the tears on the cheek, seeing lower part of the orbicularis oculi muscle. Next, loss of the nasolabial fold. You can see nasolabial fold is present over here, but this side nasolabial fold is absent. Okay. Next, you can see drooping of the saliva from the angle of the mouth. This is because of the paralysis of the orbicularis oris. Oris muscle is present around the oral opening, okay, and orbicularis oculi around the opening of the eye. Okay, so like this, these are the muscles which get affected. That's why these are the phenomena, or you can say these are the characteristics which are seen in the Bell's palsy. Okay, now this particular features which whatever I have mentioned, that is in lower motor neuron lesion. Okay, till now I have not explained what is lower motor neuron and upper motor neuron. That I am explaining now. That I will explain next. Now here you can see supranuclear lesion or upper motor neuron lesion. Okay, in that what happens? Okay, so first of all there will be the facial nerve usually will become a part of the hemiplegia. with injury to the corticonuclear fibers. Okay, so the lower quarter of the opposite side of the face will get paralyzed. Lower quarter of the opposite side of the face will get paralyzed. Okay, why? Because here the fibers which are coming from the cerebral cortex, those fibers used to cross. Okay, that means deposition of the fibers are taking place. इसका मतलब क्या है? जो you know that two cerebral hemispheres are there, right and left cerebral hemisphere. Okay, so if the fibers arising from the right cerebral hemisphere, okay, ultimately what it will do, it will cross or it will deposit, it will go to the left side, and from the left side will go to the right side. Now in this particular type, when the paralysis is taking place, it is called contralateral, means paralysis is taking place on the opposite side of the body. Okay, so as you can see, only the lower quarter of the face opposite side is paralyzed. Lower quarter of the face, that also opposite side will get paralyzed. Okay. Next, the upper quarter will remain unchanged. Why? Because of bilateral representation of the cerebral cortex. Okay, because those particular facial muscle is having bilateral representation, means from both the side nerves are coming and supplying. Okay, that's why the upper part will remain unaffected. Voluntary movements are affected and emotional expression remain normal. So the voluntary effect or the voluntary movements will get affected, but the emotional expression remain unaffected, because for that separate pathways are there. Okay. Now the question is, what is this supranuclear lesion, or also called as upper motor neuron lesion and lower motor neuron lesion? For that, can you see a diagram which I have added over here? Concentrate on this diagram. Now here you can see this is the cerebral cortex. As I say, two cerebral hemispheres are there, right cerebral hemisphere and left cerebral hemisphere. Okay. So when you will study the cerebral hemisphere, at that time you will come to know that the cerebral cortex, okay, from the cerebral cortex, the fibers which are coming out. Now those particular fibers will go and will rely on the nuclei which are present in the brainstem, and from those nuclei mostly the cranial nerves are coming out, or the origin of the cranial nerves are taking place. Okay. Before that, please keep that in mind. How many cranial nerves are there in our body? 12 pairs of cranial nerves are there. Among them, most of the cranial nerves, they arise from brainstem. Okay? Most, not all. If you take the section of the brainstem at various level, at that time you will come to know that for each and every cranial nerve, a particular nucleus is there, and for some cranial nerves, more than one nuclei are present. From that particular nucleus, the fibers of the cranial nerve comes out. Okay. Now for your reference, you can see this is the facial nerve nucleus. From here you can see the fibers of the facial nerve are coming out. Okay. Now if the injury is taking place at this level, or if the injury is taking place or compression of the nerve is taking place at this level, these fibers, then it is called as lower motor neuron lesion. Okay, that is called as lower motor neuron lesion. Okay. Now if the lesion is taking place at the cerebral cortex, or the fibers which are coming from the cerebral cortex and relying on the nucleus of the cranial nerves, okay, at that time that is called as supranuclear or upper motor neuron lesion. Okay. Is it clear about the upper motor and lower motor neuron lesion? Now every time the fibers, always they are not going to the brainstem. The fibers are going to the spinal cord also. Okay. In that case, those fibers are called as corticospinal fibers. Corticospinal means from the cerebral cortex, and then it is going to the spinal cord, mainly the anterior horn of the spinal cord. We will discuss everything in the neuroanatomy, don't worry. Okay. Though it is mentioned, that's why I am telling you, so that you can understand the difference between the upper motor neuron lesion and lower motor neuron lesion. Okay. So in case of upper motor neuron lesion, if the lesion takes place in the upper motor, then the consequences are different. That means the symptoms will be different. And if it is taking place in the lower motor, then also the symptoms are different. Okay, which we have discussed. Now further, clarification, for that you have to study the neuroanatomy. Then only everything will get clear. Okay, after Bell's palsy, next is the examination of facial nerve. Okay, so with the help of the muscles of the facial expression, what we can do? We can check the integrity of the facial nerve. Okay, and in physiology, in anatomy I don't think so, time will be there, but in physiology you will be doing the testing of cranial nerves. There are various experiments, okay, by which we can check the integrity of the cranial nerves. Okay, so in order to check the integrity of the facial nerve, okay, what you can do, these are some experiments which you can do. Very simple. First, in order to check the frontalis muscle, what you will do? You will ask the patient to look forward, okay, to look forward without moving the head. At that time, what will happen? You can see the wrinkles which are appearing on the forehead. If wrinkles are appearing on the forehead, that means it is normal. If it is not appearing, suppose एक side में appear हो रहा है, एक side में appear नहीं हो रहा है, that means there are some problem with the facial nerve. Okay. Next, dilators of the mouth. Okay, that means you'll ask the patient to show their teeth. Okay, mainly at that time we are checking the zygomaticus major muscle. Next, you will ask the patient to close the eye, or what you will do? You will ask the patient to close the eye forcefully. Okay, so when patient will close their eye forcefully, at that time you will check both the eyelids are joined together or not. Okay, if the patient is able to close the eyes on both the sides, that means it is normal. Okay, so here you are testing the orbicularis oculi muscle. Okay. Next, puffing of mouth and then blowing forcefully during the time of whistling. Okay, so whenever a person whistle, okay, I hope everyone you know what is whistling. So whenever you are whistling, at that time which muscles you are using? Buccinator muscle. Okay, so like this you are checking the buccinator muscle. So this is the various way to test the integrity of which nerve? Facial nerve, which is the 7th cranial nerve. Okay. Next, another important applied aspect of the face is trigeminal neuralgia. Now, this is related to the sensory nerve supply of the face. Do you remember the sensory nerve supply of the face, which we have discussed in the last class? The facial muscles are supplied by which nerve? Facial nerve. That is the 7th cranial nerve. That is the motor supply. What about the cutaneous nerve supply? It is supplied by trigeminal nerve. What are the divisions? Ophthalmic division, maxillary division and mandibular division. Okay, these are the 3 divisions which are responsible for the cutaneous innervation of the face. Not entirely, except the skin over the angle of the mandible, which is supplied by great auricular nerve. Okay, please revise whatever we are discussing in the class, because see that particular part is related to this one. Now the question is, what is this neuralgia? Anyone? Neuralgia का meaning क्या है? Algia means pain. Okay, so what is this neuralgia? The pain occurs when there is irritation, compression or damage to the nerve root. Okay, at that time the pain which occurs, that is called neuralgia. Now, an important point which is related to this neuralgia is, when a person is suffering from neuralgia, at that time there will be severe pain. Okay, and that particular pain is felt throughout the distribution of the nerve. मतलब एक ही पॉइंट में पेन नहीं होता, जहां पे नर्व जाएगा, from that particular point you will feel the pain. Okay, that is the neuralgia. So trigeminal neuralgia means damage or irritation to the root of the trigeminal nerve. That's why the pain is felt. Okay, and this type of pain is very severe. So it is a clinical condition characterized by sudden paroxysmal attack of severe pain lasting for few days to several hours. Several hours to few days also. Okay, and it is confined to the distribution of one or more division of the trigeminal nerve. Now the pain occurs maybe due to the distribution of one or more than one division of the trigeminal nerve. Now this trigeminal neuralgia may involve one or more division of the trigeminal nerve. Mostly which one is involved? What is V2? Anyone? It is the maxillary division of the trigeminal nerve. Short form is written like this. V3 is the mandibular division of the trigeminal nerve, and 1 is the ophthalmic division of the trigeminal nerve. Okay. So most commonly affected nerve, okay, in trigeminal neuralgia is the V2 or the maxillary division of the trigeminal nerve. After that, V3 and very less involved nerve is the V1, that is the ophthalmic division. Okay. Now, इसमें क्या होता है? The sudden stabbing pain are often set by touching the face, okay, where this particular nerve is supplied. Then this particular pain occurs after a triggering effect. Now that triggering effect may be due to whenever you are brushing the teeth, okay, as you can see, brushing, then shaving, drinking or chewing. So this will trigger the pain, and after that there will be severe pain, and when the pain occurs, it will be felt throughout the distribution of that particular nerve. Now it may be associated with the single division or it may be associated with the more than one division of the trigeminal nerve. Okay, that means अगर कोई patient का trigeminal neuralgia है, suppose if a patient is having that trigeminal neuralgia, okay, at that time how the pain triggers when you will be doing some of the activities. And those include, suppose you are brushing the teeth, then you are shaving, you are drinking or chewing, and these are day-to-day activity. Okay, a person has to perform those activities, right? So at that time it will trigger the pain, and when the pain starts, it will be severe, excruciating pain. Okay, and एक जगह पे नहीं रहेगा, it will spread throughout the distribution of the trigeminal nerve of one division or more than one division. Okay, that is the trigeminal neuralgia. Severe pain होता है. Okay, so the pain often initiated by touching and spatially sensitive triggered zone, as I said, and that may be due to brushing, shaving, drinking, frequently located around the tip of the nose or the cheek. These are the areas which are mostly affected. Okay, now in trigeminal neuralgia, the neurons which are present, okay, the nerve fibers, demyelination of the axons of the sensory root occurs. That's why the pain is more. Now, when a person is suffering from trigeminal neuralgia, there are various ways to reduce the pain. For example, injecting 90% of alcohol into the affected division of the trigeminal nerve. Then there is a procedure called medullary tracheotomy, where the sectioning is done of the affected nerve. Okay, and that procedure is called as tracheotomy. Other treatment include radiofrequency selected ablation of the trigeminal ganglion by a electrode passing through the foramen ovale. Okay, so these are some procedure by which the pain can be subsided. Okay, so this is the trigeminal neuralgia. Next, testing the sensory nerve supply of the face. So previously I have shown you to check the integrity of the facial nerve. What you have done? You have done various action, facial expression. Okay, that means you will ask the patient to show the teeth, you will ask the patient to whistle, you will ask the patient to look forward to see the wrinkles. So उसका function क्या है, उसका meaning क्या है? That means you are checking the integrity of the facial nerve. ठीक है? So that is the motor supply. Now what about the cutaneous supply? For that what you have to do? For that you have to check the integrity of which nerve? Trigeminal nerve, the divisions of the trigeminal nerve, 3 divisions. For that what you have to do is very simple. The sensory function of the trigeminal nerve is tested by asking the person to close his or eyes and respond which type of touch is felt. So first of all you will ask the patient to close the eye and then you will touch the face, okay, with various instruments, and then you will ask the patient whether he or she is feeling that touch or not. Okay. For example, a piece of dry gauze is gently stroked across the skin on the side of the face. Okay, you will take a dry gauze and you will strike the side of the face. Okay, and then one side is done, and then you will go to the other side. Then you will ask the patient whether you are feeling or not. If the patient is feeling that something is present on either side of the face, that means this particular part, the cutaneous nerve supply is there. Okay, next the test is repeated. Why you have to repeat the test? You have to check the integrity of 3 divisions of the trigeminal nerve. That means you have to do it over here also, you have to do it over here also, you have to do it over here also. Okay, because 3 division. Okay, that's why 3 areas you have to check to see the integrity of all 3 divisions of the trigeminal nerve. Okay, next what you have to do, the person is asked if one side feels the same or different from the other side. This is also important when you are checking this integrity. Now testing is repeated, and after that what you will do, you will use a suppose instrument which is cold, and then suppose a forceps is there. Okay, now you have kept it somewhere and you have made it cool, and then you will ask the patient, you will touch and you will ask whether the patient can feel the temperature or not. Patient can feel whether it is cold or whether it is hot or not. Okay, so like this different areas, different tests are done to check the integrity of the various divisions of trigeminal nerve. Okay, this is the testing of divisions of trigeminal nerve. Okay, next herpes zoster ophthalmaticus. This is a important clinical condition. Okay, so what happens in case of herpes zoster ophthalmicus? Here the viral infection involving the ophthalmic nerve is taking place. Okay, it presents as severe pain and edema. Pain will be there, edema will be there in the ophthalmic territory, and characterized by appearance of vesicles, which are fluid filled blisters along the course of the cutaneous division of the ophthalmic nerve. Okay, so this herpes zoster ophthalmicus is a viral infection. When it occurs, at that time what will happen? There will be severe pain, along with that there will be edema, and on the cutaneous part you can see the blisters, fluid filled blisters are present. Okay, and that can be seen throughout the distribution of this particular ophthalmic division. Okay, next is the dangerous area of the face. So what is the dangerous area of the face? Already we have discussed. Okay, that is the upper lip and lower part of the nose. This is the dangerous area of the face. Okay, so if there is any pustule or pimples, don't try to squeeze it. What will happen? The infection can spread in retrograde direction. Okay, and if it spread, there may be chances of getting thrombosis in the cavernous sinus. Now, when you have studied about the scalp, I hope you have studied about the scalp. No, when you have studied about the scalp, you have studied all the layers of the scalp, right? So have you studied the applied anatomy of the scalp? Now, in applied anatomy of the scalp, there is a term that is called black eyes. Have you heard about it? Though it is a applied anatomy of the scalp, but the visualization, it can be seen in the face. That's why I have included over here. As you can see, the black eye. Okay, so उसमें क्या होता है? Any idea what happens in the black eye? Which layer of the scalp is injured? Yes, loose areolar tissue. Okay, so you can see the collection of the blood. Okay, in the loose connective tissue causes generalized swelling of the scalp. After that, what will happen? How the blood comes up to the eye? Damage is taking place in the scalp. Then how come blood is coming into the eye or associated areas? Have you studied about the occipitofrontalis muscle? दो part होता है, occipital part and the frontal part. Now, the frontalis part, where it is attached, any idea? It don't have any bony attachment. The frontalis part which is there, it don't have any bony attachment. It is attached to the skin of the eyelid. Okay, so this is a very important reason. Now the blood extended anteriorly into the root of the nose and into the eyelids. Why? because as you can see, the frontalis muscle has no bony origin. Okay, that's why gradually the blood comes anteriorly. If bony attachment is there of that particular muscle, then blood would have stopped in that particular area. Okay, that's why the blood is coming towards the eyelid, and then this particular appearance can be seen, which is called as black eye. Now the posterior limit of such hemorrhage is not seen posteriorly. Why? Because the occipitalis part is having bony attachment. It is attached to the nuchal lines which are present in the skull, posterior aspect of the skull. Okay. So this is the black eye. So that is all about the applied importance of face. Though it is seen in the face, facial region, that's why I have added, but actually this is the applied importance of the scalp. So please listen one thing, scalp is a very important topic. Okay, please prepare it properly along with the applied importance. Okay, so you have to know about all the layers, you have to know about the nerve supply, blood supply thoroughly along with the applied importance. Okay, so that is all about the face. So in the face we have discussed everything started from the gross structure. Okay, about the skin, about the superficial fascia, about the muscles, then blood supply, arterial, venous drainage, nerve supply, in nerve supply also motor supply and cutaneous nerve supply, then lymphatic drainage and the applied importance in detail. So I will request everyone to revise whatever we have discussed in the class. Okay, thank you.